very special that during the COVID era, during the COVID time, the dental care, which perhaps is one of the most wanted care en masse for the society, and what sort of problems being faced, and what are the practical problem, and how our dental colleagues are overcoming for this particular services, because हम सबको दांत की सर्विस की जरूरत होती है कभी ना कभी. इस चीज को डिस्कस करने के लिए देयर इज अ ग्रुप ऑफ पैनल विद अस इन फ्रंट ऑफ यू. डॉक्टर तिवारी जी ने उनका नाम बता दिया है, but I would like to introduce the moderator, the person who will lead the discussion. It is none other my friend, my colleague, Dr. Mahesh Verma. The only introduction of Dr. Mahesh Verma I would like to give, that if somebody has changed the definition of education, medical education in the field of dentistry, it is Dr. Mahesh Verma. Dr. Mahesh Verma, who is responsible for creating the MAULANA AZAD Institute of Dental Sciences in MEMC campus. And I always say this is the best dental college of India. And the way he has created, along with his other colleagues like Dr. Sangeeta and so many faculty members, I felt that this is an example for the entire country, especially from government sector. So of course, after having achieved that sort of great excellence in creating and creating some example of education and dentistry, he had been involved in Dental Council of India. He is Padma awardee and very well celebrated colleague of ours. And above all this, because of his involvement, now the government of Delhi, Lieutenant Governor, has appointed him as the Vice Chancellor of the most expanding university, that is IP University of Delhi. The IP University, which is having perhaps many number of accredited colleges, medical, non-medical, and Dr. Mahesh Verma, under his leadership, is leading the prestigious IP University. With this, I mean, whatever I have told about him is very little, but perhaps time may not allow me. Dr. Mahesh Verma, over to you, and please go ahead, and we all will like to learn what is the status of dental care during COVID time and the guidance for the society. Over to Mahesh.
Yeah, thank you, sir. I know it's nice to hear from you, because I know when MAULANA AZAD Institute of Dental Sciences came, it was under and you were the dean. And, I have, you probably understand that how all of us have jointly, I won't say singularly, my team, my colleagues, Sangeeta is a testimony. She's right here, and all of other team members who are not here. We have jointly, made an effort and tried to, turn around dental care in the city, and not only that, be a leadership, provide a leadership in the dental care in the entire
country.
country.
That's why I say in country.
Yeah. So it's a great privilege for me. It just happened through me. I feel it had to happen, and probably it was just waiting for somebody to turn it around, and it happened. I happened to be there, holding the chair. So I don't think I don't give any credit to me. Probably I always give credit to my team, my colleagues, my students, my staff. Those unsung heroes. They all put in effort, and example is there in front of you. So it feels nice also that you've been able to do something for the profession, to the society, also a little bit contribute to the country development altogether, because now this art institute is it's a little bit known not only in Asia Pacific but other parts of the country. And very happy that Sangeeta Sangeeta has taken over from me. She has been my deputy. She's been my vice principal, and she knows all the all things very well, and she will probably bring it to a you know bigger glorious height. So without much talking about maids and ourselves, let's talk about the topic today. As we all know, I think you gave a very nice beginning, that dental care uh, is one of the most wanted care, and we all realized it during the COVID, because many of us, we got umpteen calls from our patients that they were ready to do anything, but they want to be treated, because there was an urgent care, there was an emergent care, there was which couldn't wait. And in the beginning, there were no guidelines. Everybody was groping in dark, what to do, how to do. There was a complete lockdown. Stepping out of the home was a big no. It was a big sin. And under those circumstances, how do we do? But my appreciation again to teammates. Dr. Sangeeta ensured that the facilities continued, and in spite of complete lockdown, I think our staff, our doctors, they served patients and they looked after the dental need. So it's yes. Then it only, why I'm talking this is, it only highlighted the importance and the need of the dental care, because sometimes, because dental treatments are not life threatening, and we sometimes we don't think that these are so important, but dental care is also emergent and urgent, and it cannot wait. So that was one. And also I feel that our group, our dental professionals all over the country, we were very active right from the beginning. If you look at the historically, our groups, they all got together and started working on it and talking about it right in the beginning. I say in the April first week itself, my March end, when the lockdown started, that how are we going to do it? When are we going to reopen our clinics? How are we providing our urgent care? And we started making protocols on our way. And thankfully, CDC, Central of Disease Control Atlanta, American Dental Association, Government of India, the dental guidelines were among the first ones which were brought out by the government, primarily because dentistry was generating aerosol, and everybody thought that aerosol is a big no. It cannot be done. It will be responsible for spread of infection. So I think we learned, we evolved, we learned ourselves, and over the time, things got cleared. Everybody understood what is to be done. As I said in the beginning, there were a lot of issues of personal protective equipment, other equipment, sanitization, protocols, how do we meet patients, what we do, what kind of masks, and there were a lot of issues. But I think with everybody's input and our own learning, things streamlined, we learned, and now I think things are very much clear now. And if you look at the dental setups, whether in private sector or a government sector, it's very happy to see that patients have started coming as they were coming before, and there is not a big hesitation now for a dental care. So from here on, but much has happened. It has not happened overnight. It has taken months to reach this far, and a lot of efforts have been put in by our colleagues, our education, our teachers, our professional bodies. So I think at this juncture, we will probably have a question and answer session later. But at this juncture, may I invite Professor Sangeeta Talwar to share that how she was able to sustain, how she was able to maintain, sustain, create, re-engineer, redefine, restructure, the dental care, so that dental care could be provided to all the needy all the needy, all our patients. Because I want to share you why I'm saying this, because during lockdown, all the private clinics, most of the private clinics, except maybe few here and there, were closed, and all the patients were sent to government setups. So either All India Institute of Medical Sciences or MAULANA Azad Institute of Dental Sciences or similar establishment in the city. So how they were able to evolve themselves, how they were able to create the guidelines, protocols on their own, because things came much later, how they were able to set up. So let's listen to Professor Sangeeta Talwar and her experiences, and what are the protocols now being practiced today. Professor Sangeeta Talwar, please.
Yes, sir. Thank you so much. At this moment, I would like to thank Mr. Tiwari of Double Helical for inviting me to this forum. And I'll make a brief presentation. And I have been asked to speak on guidelines for dental professionals in COVID-19 pandemic situation. So I'll just briefly share the screen with you.
Yes.
So good afternoon, ladies and gentlemen. As I said before, the topic of my presentation is guidelines for dental professionals in COVID-19 pandemic situation. Now, as has been mentioned before, this is where I work, MAULANA Azad Institute of Dental Sciences, which has been providing uninterrupted dental services, the only dental care provided at one point of time, as Dr. Mahesh Verma just mentioned before I started speaking on this. So the first step is to provide the pre-screening area for the patients. You can see this on the left side, a tent. This was just at the end of March when COVID situation had come over. Yes, a tent had been erected just outside the building. We were not very sure how to go about things. So this was the first thing that we did, followed by development of institutional standard operating procedural guidelines, that is the SOPs, that followed. Now this slide shows the overall task force and direction of work which the institute took. It started from the pre-screening triaging, followed by dental triaging and registration. Then departmental procedural guidelines were developed. Then biomedical waste management, numerous committees, we had to make so many of them. That included biomedical waste management committee, hospital infection control and training, information technology, media and website management, institutional policy coordination committee, academic activities and student welfare also had to be taken into account. Infrastructural modifications, this was a very important area we had to work on. It should be worked on. COVID-related purchases and finances have to be managed. Centralized emergency clinic committee, and finally the employee welfare committee. So what is the process of patient flow? First is, as I said, it is the pre-screening, followed by sample collection. Now in this, if the patient tests negative, then of course the patient is directed for dental triaging. But if the patient comes positive, if the patient tests positive, then he and she is advised home quarantine. Now, if the patient is negative, of course, then after dental triaging, he should be referred to the concerned specialty or department for further treatment. Now, in this picture, you can see the entrance to my hospital. And as of today, approximately 400 patients per day are seen. No accompanying person is allowed. This is just to prevent transmission. Hand hygiene, as you can see, that is done right at the beginning as soon as the patient enters the campus. Physical distancing, you can see here, the patients are standing in a queue and at least 1 meter distancing is followed. Ideally, it should be 6 feet, but here, because of the lack of space, or if there are more patients, then at least minimum 3 feet distance has to be maintained between patients. Then separate areas. Since a lot of patients come to our hospital, so separate areas for old and new. This is the area which was created for old patient registration. And on the right, you can see this modification, infrastructural modifications had to be done. We had to carve out an area where new patients were registered. So in this pre-screening, there are 3 levels of pre-screening which need to be done. As soon as a patient comes, thermal screening is done. This is basically an alert just to know whether the patient is having temperature, raised body temperature or not. After this, medical screening is done. In this assessment of symptoms, the main symptoms by which a patient can be kind of identified whether he or she may be COVID positive. They are fever, cough, which is a dry cough, sore throat, headaches, respiratory distress, that is breathlessness. And after this, the dental need assessment is done. Till date, about 20,000 patients have undergone pre-screening in the institute during this period. After the pre-screening, the patients have to be referred to sample collection. And 2 types of sample testing and collection is done. That is rapid RAT. We all know rapid antigen testing, and RT-PCR, this is done. And testing is mandatory as far as this institute is concerned. It is mandatory for all patients. Until now, 4,000 patients have been tested. So following this, once we know the patient is negative, dental triaging is done. The patient is referred to Department of Oral Medicine and Radiology, and dental need assessment is done, followed by referral to the concerned specialty where further treatment will be done and is done. So as is said, change is the need of the hour. And COVID has led to changes in departmental protocols. What are they? Infrastructural changes have to be done. Changes in clinical protocol. Infection control measures. So in infrastructural changes, transparent screens on the reception desk, because this is a hospital area, hospital has to deal with a large number of patients coming in. So these have to be put up at the reception desk as a barrier to prevent transmission of this virus. Then in the departments, social distancing. You can see this picture. The patients are made to sit at least 6 feet. See, one chair has been left in between, so that adequate distance is maintained between the patients in the waiting area. Then we see the pedestal fans. This is important for air ventilation. And also we see in the picture the air purifiers, which are fitted with HEPA filters for air purification. This is important for any dental operatory. In a hospital, area, segregation of the clinical area needs to be done. It needs to be separated from the academic areas. So what are the changes in clinical and departmental protocols? The minimum manpower requirement, as you can see, one is a chairside assistant, that is usual, who assists the dental surgeon. Then we have an optional second assistant who can transfer the patient and prepare the patient, material handling and all that. This is optional, may or may not. But the third one is very, very essential, and that is the sanitation and the cleaning staff who will turn over the patient, clean the chairs, dental chairs, and all the accessories. Then the personal protective equipment, this is absolutely mandatory as a barrier protection, both for the dental surgeon and the assistant. Now, to reduce the viral load in the saliva, this is a standard procedure otherwise also, but in COVID times, we have to be extra careful. Pre-procedural mouth rinse, usually 1.5% hydrogen peroxide, or even 0.2% povidone for 1 minute, it can be done. And extra oral scrubbing with the same can also be done. It should be done actually. Now, to reduce aerosol generation, this is extremely important as far as the practice of dentistry is concerned. HEPA filters and pedestal fans, you can see in the picture, a fan has been placed behind the operator to provide air ventilation. And here you can see the air purifier fitted with HEPA filters. They are placed and they help in the air exchange and purification of the air within the operatory. In a clinic having large number of chairs, you can always work on 2 chairs which are at least 2 meters away from each other. And to reduce aerosol generation, you can see a picture of electric motor. This can be used. Application of rubber dam, it is mandatory, and as well as the use of high volume suction, that is also equally important. In infection control, the changes, these are standardized as per NABH protocol. Disinfection of water pipelines with 1% sodium hypochlorite after every patient, and 0.01% sodium hypochlorite in water inlet bottle for air rotor usage. These are standardized. Then in COVID times, mopping with a disinfectant, that is the change which has been done. Instead of spraying, we don't want any aerosol in the operatory, and a minimum gap of 20 minutes between 2 patients after aerosol generating procedure has been used, in case if an air purifier is present in a clinic. In case we don't have an air purifier for ventilation, then this 20 minutes actually goes up to about 40 to 45 minutes turnover time, because if you divide it, 20 minutes for fumigation, about 10 minutes maybe for clearing the air after that, and 10 minutes for preparing for seating of the patient in the operatory. So it is advisable that all of us have an air purifier in our operatory to reduce the turnover time of the patient. It is safer as well. And at the end of the day, fumigation is done using a fumigator. I'm sure everybody is using that. And these days, hydrogen peroxide, combination of hydrogen peroxide and silver nitrate is being recommended. This is National Accreditation Board of Hospitals and Healthcare Providers, NABH, and MAULANA AZAD Institute of Dental Sciences was the first dental institute to get NABH accreditation way back in 2011. Now, as you can see in this slide, as of today, This is the figure, this is the number of patients that have been treated till date. And month-wise, if we see in April, it was 96. The graph is climbing steadily. And by September, about 5,000 patients had been treated in the month of September itself. So we see patients have started coming in, and all of us have to be ready and prepared to treat whosoever is reporting to us. Yes, the unsung heroes. How can we forget these people? It is really unthinkable because not much is possible without the sanitation workers and security personnel who manage the crowd to follow the protocols for COVID-19. And we now know that life doesn't have to stop because of coronavirus. All the lockdowns, we are into the 5th lockdown opening phase. And as you can see in this slide, during this period, virtual training of healthcare professionals, all faculty, all staff, including the students, for infection control, donning and doffing, that was done. It is a continuous process in the institute. And alongside, examinations also were conducted. All postgraduate, undergraduate examination, online lectures for undergraduate and postgraduate students were conducted and are still being continued all the time. Several continuing dental education programs and webinars were conducted during this period. Basically, I want to say that nobody stopped working during this difficult time passing through. So the take-home message, A to E, air ventilation and management, barrier protection, clean hands, disinfection protocols, and of course, education. Without that, educate the staff, patients, all of us. We can't do without that. So what is really required is that we should adapt to these difficult and unprecedented times, and maybe all of us should take this Hippocratic oath again. I will prevent disease whenever I can, for prevention is preferable to cure.
Yes, friends. I think Sangeeta, wonderful presentation, and it only shows that you're great, your determination, your zeal, your passion, and what it is always said that when
Can you speak after that?
when the human
आपका
beings
नाम
are
बोला जाएगा आप
when the human beings are exposed to such adversities, the adversities itself makes you wiser. Adversities itself, allows you to find a solution. So, you have very, very ably and amply, you have described that how in May, April, I think you were treating just about 76 patients, 96 patients.
Yes, less than 100. Yes, sir.
You are treating more than close to 5,000. And in May, I think you were treating about 800. So even in April, when everything was, even bird was not visible, you were still, your team was still looking after the care. So congratulations to you. And some of you must be wondering that this is what is happening in our organization. And we have a large number of dental professionals in the country, and whether it would be it would be any different in a dental care, because yours is institution involved in education, academic activities, treating large number of patients. The design of clinics is different. You kind of infrastructure you have is also of a different level. So now we have some very bright practitioners here, and let us understand from them that what they have done, what they have been doing. But I must, before I invite them over, I must highlight here that, more or less, the protocols are very similar. Only thing, the scale can be different, the size can be different. And, since you are doing it at a big volume of patients, so you may probably have to structure it, strategize it, systemize it slightly different. And if we can bring it down to a clinical level, which is a very minuscule or a smaller component of a big organization, it essentially remains the same. Only thing, the scale would be smaller. So let us listen to some of our professional colleagues, that how they have been doing it and what they have been doing, so that it is they can share their experiences, they share their systems with other professional colleagues. So Mr. Tiwari, who is scheduled to be the next speaker, would you please invite?
Dr. Abhishek Kukreja, he's a maxillary surgeon.
Yes,
Dr. Abhishek Kukreja.
Yes.
Yeah. Thank you, ma'am, for giving us such a good presentation and enlighten us the procedure that MAULANA AZAD is following. Because the MAULANA AZAD, I think it's always sets a benchmark, and it always gives us a way that how to do the procedures in such a tough time. And thanks, Mr. Tiwari from Double Helical, for giving me this opportunity. I just want to share my screen. Just can you see the screen?
Yes, yes.
Yeah.
Yeah, we can see the screen, but I think graphics is not visible.
So the topic that is given to me is aerosol and dentistry, especially from the patient's perspective, that what the patient has to see when he comes to the dental clinic, and what he can understand from the aerosol point of view, what's the aerosol is. So what's basically aerosol? If we can see, the aerosol is basically in dental clinics, there are a lot of procedures in which aerosols are produced, like while doing the crown cutting or doing the scaling, ultrasonic scaling, aerosols are produced. So the aerosol is basically, it is a particle that is less than 50 micrometers in diameter. So what we have to understand is they stay in the air for extended period of time before it settles on the surface or enters into the respiratory tract. So that's why the ma'am just told that at least 20 minutes we have to give the time in between the two procedures, in between two patients. That too, if we are using air purifiers. So if we are using air purifiers, then we have to give at least 20 minutes of time so that that aerosol settle down to the surface. And after that, after that it settle to the surface, then we can obviously go and do the procedure for the second patient. And the surface, we can use many surface disinfectants like hydrogen peroxide or hypochlorite to clean the surface. before doing the next patient. So can the aerosol infect patient from COVID-19? Yes, it can infect, because as we all know, it can enter into the respiratory tract. But there are many procedures that a dental clinic generally follows, like disinfectant of the dental water line, because basically what the aerosol is a it's the saliva and the water that coming from the dental line, so it mix up and it goes into the air and forms the aerosol. So yes, it can infect the patient from COVID-19, but as we have seen that any rare case has come from any of the dental clinics in which there are patients those who get infected after getting the dental treatment done. So the sources of aerosol in dental clinics are dental handpieces. Obviously, we have to use dental handpiece, especially the aerator handpiece, in which there is a combination of air and water that we are using for cutting the teeth, for crown cutting, and for the other procedures in which we are using. So when this air as well as the water from the dental lines mix with that of the saliva, it goes into the air, and then the aerosols are produced. The second thing is the ultrasonic scalers. The ultrasonic scalers, it also produce a lot of aerosols, then air polishers, then air abrasion units, and the three-way syringes. So all those things in which we are using the water as well as the air, all these produce the aerosols. So the aerosols are, so basically if we can see that there are two source of aerosols, the one that mix with the water, but if we are not doing any procedure, if we switch off the water and then we feel that no, the aerosols are not producing because the water is not coming from our dental unit, so that is also not true, because there are two sources. With that, if the patient comes with a, if it is a potential patient that is having that comes to the dental clinic, so the saliva and the air that we are using to do the procedures can also produce the aerosols. So now what precautions that we can take, as we all know and we all are using also. So the first thing that we can use to prevent our patients and to prevent ourselves from the aerosol is a barrier protection. That is, we can use mask, we can use gloves, eye protection. So what I think is, whenever the patient comes to your reception, the first thing you have to do is get the temperature checked. The second thing is hand sanitization. The third thing, give all your patient mask, gloves, as well as eye protection. So this similar thing we have to follow. And then the gowns. The patient also has to wear the gown, as well as the clinician has to wear the personal protective equipment, that is PPE, what we are using and what ma'am has told that all the patient has to be done using the personal protective PPE, and then that PPE gown has to be removed after each and every patient. So the advantage is it is a part of standard and it is very inexpensive, but the disadvantage of the barrier protection is the mask will only filter out 60 to 95% of aerosol, subject to liquid leakage if not well fitted. So it cannot protect 100%. So this is mandatory. What all things that we can add up so as to reduce the infection from aerosols to the patient, that is a pre-procedural rinse with antiseptic mouthwash such as chlorhexidine, 0.2% of chlorhexidine. As we all know, it reduces the amount of virus. It decreases the load of the virus, but the thing is, it does not kill it reduces the load of virus, so it reduces the bacterial count in mouth, saliva, and air. It is also inexpensive, so each and every patient that comes to the clinic So pre-procedural, it has to be done, and after the procedure also the mouthwash should be done. So now the high volume evacuator. So nowadays that we have seen that many of our dental companies, they are promoting high volume evacuator, that is extra oral suctions. So extra oral suctions, if definitely we should all use it when we are doing the aerosol producing procedures. So that high volume evacuator, what they generally do is they suck all the aerosol extraorally, and then there is a HEPA filter that is attached to it, and then there is an ultraviolet ray. So whatever virus that goes inside that HEPA filter, so that ultraviolet light is also attached to it, so it kills all those viruses. And then there is a high efficiency particulate air room filter and ultraviolet treatment of ventilation system. So then we can use, so in every surgery what we are using the aerosol procedure, so it is always better to use air purifier that is with the HEPA filters, so as to purify the air in which there are the aerosols that is suspended into the air. So that is, it is effective in reducing the number of airborne organisms. And the other important thing that we can use is the surgery should be well ventilated. So in well ventilated surgery, it has been seen that the virus load is generally low. So that we have to take care that all our surgeries where we are doing the procedures, it should be well ventilated. So what we can do is universal barrier precaution should be followed. The pre-procedural rinse should always be used before the treatment. Rubber dam, as ma'am told, that it helps in reducing the aerosol. So we have to use rubber dam where it is possible. We all know that rubber dam is not possible in all the procedures, especially when we are finishing the crown cutting. So, but wherever it possible, I think we should all use the rubber dam, and high volume evacuator should be used in all the procedures, especially in the procedures where the aerosols are producing. So this
Thank
is
you.
all. Yeah, thank you.
Thank you, Abhishek. I think
Yes, sir.
the only fact that dentistry is at a high pedestal today, and especially in COVID care, and a lot of attention is given to dental, eye, ENT, and anyone who's dealing with the mouth, is because mouth, as you said, that even though your equipment can generate aerosol, but even the patient who is an active patient of a disease can also be responsible in spreading the infection. So because dentistry is generating aerosol, and so we got to target how we reduce aerosol, how do we manage aerosol, how do we contain aerosol. And as Dr. Sangeeta said, that let us use electric engines, but everything cannot be done with electric engines. So then you came up with the aerators with or without water. Sometime we also have attempted without water, but then patient itself can be infection spreading. So thank you very much for all those four essentials, that which is very important. Managing aerosol, especially universal precautions, pre-procedural rinse, using prophylactics like rubber dam, and a high vacuum evacuation, evacuation, suction, whether as a part of the chair fitment or externally. So thank you, Abhishek,
Thank
for
you. Thank you, sir.
highlighting and letting us know, what should be done in this scenario. So now we have two more speakers now. So let me invite now Dr. Deepti. Dr. Deepti Sharma, you would like to, Deepti Sharma, are you ready? Are you okay with the with your lecture or with your views. If you don't have slides, you can share your views. You are
Okay, unfortunately, my laptop crashed down. So,
doesn't
anyways,
matter.
then I speak.
You can just highlight, you can just share in the next couple of minutes, because let's spend more time in question answers, because a lot of things will be overlapping. So you can, as an endodontist, that how you are managing these.
Okay. Okay, so it's a very good evening to all the respected members and to all the dignitary members present over here. First of all, I would like to convey my thanks to Mr. Amrish Tiwari sir for having me here and allowing me to speak today on this double helical platform. And it's indeed my it's a great honor to be here and to be present amongst all you elderly and dignitary people. And I feel myself very grateful today. And there is a lot more I have learned today. And I would also like to thank Dr. Sangeeta Talwar ma'am. She had a very elaborative and very nice presentation. Even I myself have learned a lot today. And Dr. Mahesh Verma sir, thank you so much for being such a supportive, coordinating everything and getting everybody online. So it's very great to have a connectivity and to know each other so well. I would like to introduce myself personally. I am Dr. Deepti Sharma, and I hail from Nagpur, Maharashtra, and I have done my BDS from Punjab, and after that I did my post graduation in forensic science and related laws, and I have also pursued my fellowship in forensic odontology, sir. And yes, I've done certification in implants, and I have done something off the way, which is a certified course for weapons in mass destruction for doctors from National College of Civil Defense. So this is in short just about me, and I'm very thankful and grateful today to speak here on Double Helical platform on the current scenario on the pandemic, coronavirus, which is going on. So I would like to speak just a moment. Okay, so dental care during coronavirus, what we all should know. All dentists are unitedly standing today since the onset of pandemic during March, April. I have been seeing all dentists were very afraid that due to aerosol productions, lots of water droplets and lots of splattering, the dentists were at a high risk of doing the patients because we are in direct oral contact. We are having direct contact with the patients. So that was a very high time. All the dental clinics were shut, and we were all quarantined inside the house, and we were all thinking as to how we should redefine dentistry. So with the new time and with the emerging aspects, all dentists have now reunited and they are standing strong. Hats off to the Indian Dental Association, American Dental Association, the CDC, and all the dignitary members who have guided each and every dentist with guidelines. So even and now the dentists are right on track, and we are back again with a full taking full charge and doing patients. So I would like to add on certain points that how do I care for my teeth during the coronavirus pandemic? So it's quite important to note that the respiratory virus, such as the COVID-19, it basically initiates and it spreads in the nasal and oral cavities and throat. So while touching one's eyes, it can also be a source of transmission. So practicing good oral hygiene will have effect on transmission to these locations. So, by practicing good oral hygiene, one can reduce dental diseases like cavities and periodontal disease, and also will help in maintaining good oral health, and it will positively impact the overall health. So, the Centers for Disease Control and Prevention, the CDCP, they have said that a number of recommendations about how to protect yourself and others from COVID-19. If you and your family they are staying at home to help prevent the spread, in addition to the recommendation of the CDC measures, one should take the opportunity to showcase and encourage good oral care habits for their own selves as a family members and kids. Now, one more point is there that should I replace or disinfect my toothbrush if I had been detective positive, COVID positive? So yes, it's a great practice to clean your toothbrush after every use. And if you're recovering from an illness, including that if you have been tested positive or you believe that you had a COVID-19, it is very smart that you should replace your toothbrush. And if you're unable to replace it, consider disinfecting the brush head, to help reduce the spread of bacteria. Now the infection control protocols, what we are as a dentist, what we are doing. So infection control procedures, they are actions they are taken in healthcare settings to prevent the spread of disease. At my clinic, Dr. Sharma's Dental Care, I basically, what I am doing is I'm taking care about the safety and I'm working hard to prevent the spread of this infection. So before any of my patient entering, we are examining the patient. We examine the room as well, all surface, such as the dental chair, dental lights, drawers, handles, counterparts, all have been cleaned, all are getting disinfected. We, in the clinic, we cover some of the equipments with protective covers, which are replaced after every patient. Non-disposable items like the dental tools, they are cleaned and they are sterilized for patients. And disposable dental tools and needles, they are never reused. We are discarding every time. And infection control precautions, they also require all dental staff involved in patient care to use appropriate protective equipment. All are wearing gloves, masks, gowns, eyewears whenever they are in need. So basically, I have designed a method where the patients with dental signs and symptoms, they are being treated into three parts. One is non-urgent procedures, one is urgent procedures, and one is emergency procedures. So if there is any non-urgent procedures, we are doing teledentistry. We are guiding the patients over WhatsApp, over phone calls, via emails, and teledentistry. And appropriately, we coordinate with pharmaceuticals, and we also give home care instructions to the patient. And still, if in this non-urgent procedures, if the symptom persists, we schedule their appointment, and upon patient's appointment arrival, we screen the patient for COVID-19, then we measure their body temperatures. And if the patient answers no to all the questions, and if the patient is afebrile, then patient can be treated by following recommended protocols, and then we take follow-up via tele dentistry. This was about non-urgent procedures. Now coming to urgent procedures, the patient who have urgency, we first communicate the patient via teledentistry, and and if still the symptoms persist, again the same protocol, scheduling an appointment, screening, and if they are afebrile, we go on with the treatment. And if the patient has any emergency procedures who cannot control, or the pain is unbearable, then we directly schedule their appointment, and upon patient's arrival, we screen for COVID-19, measure body temperature, and we have a COVID-19 form. We ask them to fill it, and if the patient has the answers no to all the questions and patient is afebrile, we patient can be treated by following the recommended protocols. So this was my treatment for three parts, that is non-urgent procedures, urgent procedures, and emergency procedures. I would like to also contribute by saying that what constitutes a dental emergency. I have seen patients calling for simple dental fillings or some orthodontic pains or wires has been disclosed. No, I say to the patient and I add on that according to ADA guidelines, dental emergency is one that is potentially life-threatening and requires immediate treatment. That is if the patient is having uncontrolled bleeding, or if there is any bacterial infection that could compromise the patient's airway, and if there is any trauma which is involving facial bones potentially compromising the patient's airway. So urgent dental care, they are those conditions that require immediate attention to relieve the pain or risk of infection. So here at my clinic at Dr. Sharma's Dental Care, I understand that the different response to the ongoing COVID-19 pandemic can make people unsure of what qualifies as urgent dental care or dental emergency. So here there are some instances when one should know and one should contact your dentist immediately. If there is large piece of tooth or the whole tooth is missing, if there is nerve damage apparent, such as if a patient is feeling numbness, and if you're showing signs of an abscess or infection, or if there is pain, swelling, or if the patient has any sensitivity towards hot temperatures, and if the patient is having redness or swelling. Now, I would also like to emphasize that there are some home remedies. Am I audible?
Yes, yes.
Yes.
Okay. So I would also like to emphasize there is some home remedies which I go on, which I try and explain my patient in teledentistry. That to avoid patients' footfall in the clinic and for the dentist staff and the patients uh, looking at the pandemic and the safety protocols. So what home remedies we subscribe is that cold compression. We can use ice pack. This is one of the simplest technique to relieve pain. Apply ice directly on the affected tooth externally on the cheek to numb the area. We can also use garlic. Garlic, for 1,000 years, garlic, it has been known for its medicinal properties. So one can just crush a garlic and a clove to make a paste and you can directly apply on the affected area. You may add a little salt to it or slowly chew the clove or garlic. So this will help and relieve the pain. Third point is vanilla. Vanilla extract. Vanilla extract contains alcohol, which helps to numb the pain. So it has an antioxidant properties, which makes it an effective healer and can apply some to the affected area. Alcohol is also a thing which can be used for the ones who loves the taste of it. So alcohol applied on a cotton swab and quickly numbs the area and relieves you from pain. So if you have any toothache or if you have any exposed nerve and you cannot go to a dental office or you are quarantined in the area, and if you have alcohol in your house, so you can just take a small pellet of cotton, dip it in alcohol, squeeze it and just dump it on your tooth and you will have a relief in pain. Yes, there is one more liquid which is known as wheatgrass. Patanjali has launched wheatgrass liquid. So wheatgrass, it has countless healing properties. It heals the body inside out and it has high chlorophyll content which fights bacteria well. So use wheatgrass juice as an instant mouthwash. Tips to take care of your dental health. This is one more point I would like to add. So do not skip brushing. You need to brush twice a day. You must use a mouthwash after every meal to tackle unwanted particles in your mouth. Rinse for 30 seconds before you spit out. Massage in your gums in a circular motion to ensure gums are healthy. So I recommend my patient to use Chlorny gel. It has ornidazole in it. It is an antimicrobial content in it. So a patient can massage and can use maybe daily once, and the patient can massage in a circular motion. It will help them maintain healthy gums. And yes, we should not skip tongue cleaning. Tongue cleaning is very much required, and we can use and clean the tongue with the help of tongue cleaner or with the help of cotton mixed with little part of glycerin in it. And yes, ensure that you visit your dentist, but due to this pandemic time, it is important to ensure maximum oral hygiene, which can very well be maintained and practiced at home. So in the clinic, I would like to add on some certain points that in my clinic, we are taking 6-step sterilization process. Now, what is the 6-step sterilization process? Step 1 is we wash our hands thoroughly and we
Deepti, we cannot hear you.
Dipti,
I think Yeah,
Yeah, so there is some technical issues.
I know. So we have one more speaker after this, Dr. Tiwari.
Am I
No,
audible?
no. Yeah, you are audible.
Audible now. Yeah, you quickly wind up, Deepti, now. Give us the 6 steps. What is the next step? Deepti,
Am I audible, sir?
are you audible? You
Just a moment, sir.
first step, wash hands.
Sorry.
You gave a first step, now wash hands. Come to the next step now.
The next step.
Yeah. Sterilization process you're talking about.
Okay. Yes. Yes. So we here are following steps, 6 steps of sterilization. Number one was I was speaking about that we wash and we scrub our hands. Step two is a chemical sterilization. After we do, all our instruments are chemically sterilized. And step three, we do ultrasonic cleaning. We put our instruments after chemically sterilization before we put them in ultrasonic cleaning. And step four, we do
Yes.
Am I audible, sir?
Yes,
Yes,
yes.
you're okay.
Okay. So after cleaning and chemically sterilizing the instruments, we go by ultrasonic cleaning. We put the chemically cleaned instrument in an ultrasonic cleaning machine and we sterilize the instruments. After that, we dry the instruments, and after drying, we separate the instrument with a hand gloves with a very sterile environment. We package the instrument and then we put the instrument in a autoclaving and storage machines. So this is the 6 step sterilization process which we are very much following here in my clinic. Now I would like to speak that why is infection control so very important in dentistry? Am I audible?
Yes. Can you,
Okay.
Deepti, can you
Yes, sir.
quickly sum up, so we have another speaker and then we have a little bit of questions. Yeah, come on. So why
I'll
do you
just
think
take five.
infection control is? Yeah.
Just I'll take 5 more minutes, sir.
Okay.
So why infection control is very important in dentistry? So I would like to speak that patients and dental healthcare personnel, they are mostly exposed to pathogens. So we are mostly coming in contact with blood and oral and respiratory secretions and contaminated equipment. So proper procedures can prevent the transmission of infection among the patients as well as the dental healthcare professionals. About aerosols, I'll roughly go through. I think it is already covered that usually small droplets, 50 micrograms or less in diameter, they can remain suspended in air for some time, and these particles of aerosols, they have potentials to penetrate and lodge in a smaller passage of lungs, and they are throughout they carry greatest potential for transmitting infections. So diseases such as tuberculosis, influenza, SARS, that is severe acute respiratory syndrome, they are known to be spread by these droplets and aerosols. So infections which are transmitted in dental operatory through the following routes. One is direct contact with blood, oral fluids, and secretions. Indirect contact with contaminated instruments, operatory equipments, environmental surfaces, and contact with airborne contaminants, which is present in either droplets, splatter, or aerosols of oral and respiratory fluids. So, lastly, I would like to conclude that uh, dental handpieces, aerotors, air water syringes, ultrasonic scalers, they produce large amount of aerosols. So the risk of infection from aerosols, they can be very well minimized by use of protective barriers, by rinsing with 0.2% of chlorhexidine, which reduces the bacterial count in the aerosols, proper patient positioning, and use of saliva ejectors, which are high volume suctions. So this is basically was in short which I wanted to speak on the current scenario in dentistry and pandemics. Thank you so much.
Thank you. Thank you, Deepti. I think you have not only shared your views and your measures as a professional, but you also emphasized about oral hygiene. And also some of these things are directed at general public, that they must ensure that they maintain the hygiene and they brush, rinse, massage, and tongue clean and all those things. And I think one very important message to carry home is that if your oral hygiene is good, the chances of spreading infection, we are not necessarily talking about COVID, is also less. So oral hygiene and infection spread go hand in hand. So I think that is a very important point. So thank you, Deepti, for your presentation. Now, let us invite Dr. Suresh Ahlawat. Is he around, Dr. Suresh Ahlawat?
Sir, unfortunately, he is not available. He has some problems, so he could not join the webinar.
Okay, very good. So I think we have had three kinds of professionals presenting here. We had education and a faculty, and then we have a maxillofacial surgeon, Dr. Abhishek Kukreja, and then we also have a general practitioner. So we have a blend of representation of the three sections of the profession: academics, specialized practice, and a general practice. So if we have any question at this point, we can have a panel discussion. Couple of questions we can take. But I'm sure, as Mr. Tiwari, you said that you have received some questions. You can pose those questions, and then now, if you can, then we can gather the answer to those questions, and then finally we can wind it up. I would like to highlight the carry home messages which has been given by all the three speakers before we close this panel discussion. So at this juncture, may I take certain questions of audience which can be answered by our panel of experts here. Do we have any questions, Mr. Tiwari? Have you received any?
Yeah, could you allow me?
Yes.
Sir, could you allow me to read it?
Yeah, please do
Sir,
that.
one question from.
Yes.
Sir, one question I got from Dr. Abhiranjan from Varanasi.
Okay.
He has question: can dentist order COVID-19 testing for asymptomatic patients?
Okay, it's a very good question, and let us discuss amongst ourselves, and let me have a opinion of Dr. Arun Agarwal at this point. Before, let us ask somebody else. Then we can take opinion from our worthy colleagues here. That what does Professor Arun Agarwal think? Can dentist order or ask for a COVID test? So, Professor Agarwal, please.
Ask my opinion, I will say yes.
Yes.
Yes, it has to be yes, because it's ultimately the patient, the dentist is directly responsible to patient, and patient is responsible to dentist.
Yes.
It is the care being given to the patient, and for the safety of both, a certain test is required, and that test has to be prescribed by the dentist. There is no other question. I mean,
Okay. Sangeeta, you have anything else to say? Anything to add here?
Yeah, so in case we are able to, if it is suspected, even if it is suspected that the patient may be COVID positive because of some odd symptoms, which is a pointer towards that, then surely we can. I agree with Dr. Agarwal, sir. We can always ask the patient to be tested.
Abhishek, you have anything to say?
Sir, I totally agree with both, sir, that dentist should ask the patient, but I'm not sure that the government allow us to do that or not, sir. I'm not sure.
I would like to clarify that. Deepti, I think Deepti is gone. So I like to say, Deepti, you have anything to say?
Sir, I think every patient should, a dentist should be allowed to test because we are the ones who are dealing directly with the oral cavity. We are the ones who are directly dealing with the respiratory aerosols generating procedures. So we as a dentist are at most front fighters who are dealing with COVID situations right now. And we are the ones who are right now at high risk. So yes, definitely the government should give us a thumbs up that we should be legalized in taking the COVID samples and giving it for testing, sir. Every dental institutions, every dental clinic must have their own COVID labs. So I definitely am very much in with this thought, this process. Because for
Yes,
every lab, sir, it is not possible. हम 125 करोड़ की जनता है और ये बिल्कुल संभव नहीं है कि सारे पैथोलॉजी लैब्स इतने सारे लोगों का टेस्ट करें. अगर हम स्मॉल स्मॉल सेक्टर्स में भी टेस्ट करेंगे तो काफी ज्यादा सारे लोगों का टेस्ट ये पॉसिबल हो सकेगा विदाउट एनी फॉल्ट टेस्ट. आजकल ये भी हो रहा है कि
I like to,
एंटीजन टेस्ट नेगेटिव आ रहा है,
I
पीसीआर
like to,
पॉजिटिव आ रहा है.
I like to clarify here.
Yes.
Number one, I like to also through this answer also like to inform the individual who have put this question. One, there is no bar for any dental professional asking for a test. Number one, any any healthcare professional can ask for a test because test is not being done by a healthcare professional. It is done by a lab, which is a certified lab, which is a registered lab with ICMR. And there is a central registry for, especially for RT-PCR.
Right.
So now that is one. Secondly, also I want to tell you that, recently, I think about 1 month and a half back, we have access to rapid antigen test. I want to tell you that way back in May or so, when we were groping in a dark, American Dental Association, California Dental Association allowed every dental office can do a rapid antigen test. And I'm sure rapid antigen test is no rocket science. It's like a pregnancy test that you just take a sample and you dissolve it, put a drop into that box, and it will give you a result in 10-15 minutes, whether you are a positive or you're not a positive. So yes, for RT-PCR, you cannot. There has to be ICMR registry. It needs a skilled lab. It needs the equipment, which is expensive equipment. We cannot have in dental offices, and there is no need. We can always order it, and you can get it in 12 hours time now. Turnaround time is only about 12 hours. But yes, I think as the need grows, and I only hope this pandemic should not last too long, that we can do rapid antigen test, which is not very expensive, can be done in dental offices. But nevertheless, even then, don't need to. We don't. There is no issue of ordering it. You can get it done in any lab, and they will share the result with you immediately. So it is very clarified that there is no bar on a dental professional from ordering a COVID test. And as Abhishek said, now I want to share with you that MAULANA Azad Institute of Dental Sciences, every day they are collecting samples for RT-PCR, rapid antigen, and they are sending to MAULANA Azad, and every day they have to share the figure with the government authorities every day in the morning. So they calculate how many tests has been done in the last 24 hours, and the data from the dental college is also included in that data. So it is, I'm sure it is clarified to the individual professional who has posed this question. Can we have the next question now, please?
Yes, sir. This is a very unique and question, and that has been sent by our friend Dr. Swati Waliwal from Mohali, Punjab. The question is: a dental healthcare provider has had a close contact within 6 feet with a COVID positive individual. Can the health provider like us continue to work if asymptomatic? Why should they do?
Yes. Of course, we can have an opinion. Let's have Dr. Arun Agrawal's opinion. Then I like to share my opinion. And if there is anything it can be added by our colleagues. Professor Arun Agrawal.
If there is a history of contact with the COVID positive person, for a particular duration and distance, then that person, that healthcare worker, has to be given protocol as per the universal protocol. And that there's a universal protocol that there should be a definite quarantine. The duration may keep changing. I'll like others to comment, but there is a quarantine protocol and that should be implemented.
I like to also agree with whatever Professor Agarwal said, that you see, we are talking, what are we talking these days? More tests, ramping up testing, and contact tracing. What is contact tracing? Contact tracing is if somebody has had a contact with a COVID positive patient, he has to be traced and he also has to be isolated. So that is contact tracing. And so if we know, we have come to know that we have had a contact with a COVID positive patient, even then we do not have a symptom. And I want to share with you that yesterday I was on a webinar, which was, we had top-notch respiratory medicine specialists that 50% of COVID positive patients have no symptoms. Only 50% patients have symptoms. And out of those 50%, those who have symptoms, only 5% have sizable symptoms. Most of them have very mild symptoms, which sometimes go unnoticed. So a large number of our COVID positive patients have no symptoms, even though they may be positive. So symptoms are not diagnostic criteria that there is no symptom, so he can continue working. If you must have seen that when a VIP or somebody important who's in a public life becomes a COVID positive, they announce on their own that I am COVID positive, and anybody who has met me in the last 2-3 days have to get themselves isolated. So it explains that even symptoms has nothing to do with COVID positivity or not positivity, because large number of patients can be symptom free and yet be caused. Another thing I want to tell you, one more interesting I would like to share with you, that rapid antigen test has a very high specificity, but it is there's another term that, you see, if through a rapid antigen, if somebody is positive, it is certainly going to be positive. RT-PCR is also going to be positive. But if somebody is becoming negative, then there is quite likelihood that we should get another RT-PCR to truly rule out whether he has been a false negative. So if we have a rapid antigen test and if it is positive, it is so. That is why we are saying that, the best thing is to get a rapid antigen test. And today in Delhi, we are doing 60,000 tests. Out of that, 50,000 tests are rapid antigen tests. Only 10,000 tests are RT-PCR tests. So large screening cannot be done through RT-PCR tests. More expensive, more time consuming, more labor intensive, whereas rapid antigen is idiot proof. Anyone can do it, isn't it? All our dental professions can learn. There's no learning in it. So we can do it. And so it answers the question of the professional, that if the patient doctor has had a contact with a COVID positive, even though there are no symptoms, right away, as Professor Agarwal pointed out, whatever the protocols are there in that state, when it keeps changing. Earlier it used to be 14 days. Now it is, I think, about 7 days. So because the crucial symptoms appear on the 5th day, the first 3 days and first 5 days in COVID is very important. And the virus does not replicate after 9 days. And everything gets over by 28 days. That is the life cycle of a COVID virus. Day 1, no symptoms. Day 3, symptoms can appear: cough, breathlessness, fever. And it could be high fever, it could be breathless, there could be a 6-minute walk, 6-minute walk test positive. You walk for 6 minutes and your SpO2 level comes down 4 or 5%. So it can happen on 5th day. By 9th day, it stops replicating. By, I think, 18th day, IgG and IgM. IgM appears first. It gets disappeared. By IgG, I think, appears till about 14th day or so. But by 28th day, everything is over. So there is a life cycle of system, a life cycle of COVID virus. And if there is a contact, the doctor have to get isolated right away. Okay, Sangeeta, you want to say anything else?
Yeah, so I would like to add to what you have said. To the original question, I believe it was whether testing is required if somebody comes in contact with a positive patient. What parameters I know of is being followed is that less than 3 feet and more than 15-minute duration. If the contact is such, then the test is absolutely mandatory. This is what we are following in our institute also.
This, Sangeeta, this less than 3 feet or less than 6 feet is a debatable issue. WHO may say less than 3 feet, but it's a debatable issue.
Yeah.
Right? So let us be on the safer side.
Absolutely right, sir.
Is there any other question, Mr. Tiwari?
Yes, one question from my friend Antriksh developer Rakesh Yadav.
Yes.
He is very conscious about his staff health issues. He has question, since coronavirus can spread via aerosol transmission, should my staff be using scale instruments or hand piece any differently than what we usually do?
Come again. I have not, the question is not very clear. I think the first part of the question is whether COVID infection can spread through
aerosol transmission.
Aerosol is yes, but I think he's meaning by air.
Yes.
Not by droplet, but he's saying that is it in air? Just like any.
Mahesh, I think this question has come from somebody who belongs to construction industry.
Yeah, construction.
Yes. Builder.
Cutters. There are machines which are cutting the stones
So
or wood and all.
Can Mr. Tiwari, can you read that question again, please?
Since coronavirus can spread via aerosol transmission, should my staff be using scale instruments or hand piece any differently than we usually do?
What handpiece, scaler or what handpiece, scaler?
Hand piece, what I don't know what he want to say, but scale instrument or hand piece? Scale instruments or scale piece?
Is he a doctor or is he
No, not a doctor.
From construction industry. कंस्ट्रक्शन इंडस्ट्री में जो कटर्स होते हैं, चाहे वो वुड के हों या स्टील के हों या स्टोन के हों, उससे
no, you see, objective is that nowadays we are talking, there are so many direct things and so many indirect things. One is that if the social distancing is not maintained, if physical distancing is not maintained, there could be an infection. The second thing is that because it's a industry where there's a lot of dust and dirt is gathered and it is it comes into air, and as we are talking these days that we are expecting the COVID cases to go up because air pollution is going up. So if there is a COVID positive patient around and there is a added pollution, I think it makes other people around more vulnerable. And as it is, I feel that forget about COVID. As it is, all those workers who are in this industry, they have to be masked all the time. And these masks, which is like NEP, there are similar masks by the 3M companies for oil industry, for other industries. So they have to use those masks, and those masks not only take care of all the dust and all those industry related but it will also, I think, take care of the virus spread, especially if the respirator, the mask, they are using is also is of such a grade that it can filter the virus as well as the dust particles. So if it is all the more needed. I think all those, it's forget about those hand pieces because that's different, and it is not aerosol. I think it is just, I wouldn't call it aerosol because aerosol has got a moisture. If they're using moisture, obvious, then it becomes aerosol. If they're using water, using a gun handpiece, which is also having a water, then it becomes like a sandblasting with water. Then it becomes, it becomes aerosol. But if it is only air, like a pneumatic, sometimes they use a pneumatic handpiece to cut the stones and to cut the bars and cut things in pneumatic, which is only air. Then it only generates the dust, and that dust can also be very dangerous, pollutant, and also it will that's my feeling that it will make the individuals all the more prone to infections. Anything, Professor Agarwal and Professor Sangeeta, you want to add anything?
I fully agree that ultimately it is mainly protection to the dust being created in construction industry, and all steps should be taken to protect from the dust.
So I think this is the time now that we try to sum up things. And
sir, one more. This is very interesting question.
Okay.
One Ruchika Tuteja from Bihar, Patna. She's asking, could you tell me, are dental X-rays safe and needed, especially in the COVID era, while I'm going to take the treatment from any dentist?
I think Dr. Sangeeta would love to explain this answer. Sangeeta?
I don't know why there should be a question in the mind why X-rays are not safe in this era. Even if it is not COVID, whatever infection precaution for prevention of transmission of any kind of disease, we have all kinds of patients coming to dental operatory. So whatever protocols we follow otherwise also, they hold true for this time as well. So we surely can do X-rays in this COVID era also.
I would also like to add here, that X-rays are a very essential part of diagnosis. You must have seen that the CT scan, which is not exactly X-ray, is one of the very important tools to diagnose pneumonia patches. And if it is more than 50% involvement, it is declared pneumonia, COVID. Similarly, dental X-rays are very important to assess the urgent care, as Deepthi said, urgent and emergent care. And the only thing is that these days we are avoiding intraoral X-rays, where we have to place an X-ray film inside the mouth, or we have to place a sensor inside the mouth so that there is a saliva, it generates saliva, and it can be a cause of a spread. So we are using normally non-contact digital X-rays like OPGs and others. So X-rays are absolutely fine. There is no problem. And I think, in fact, without X-rays, we would be rather handicapped. We will not be able to diagnose cases properly. And there is no link whatsoever with the X-rays and a COVID disease or COVID spread, except that we will avoid intraoral X-rays and go for extraoral X-rays. Is that right, Dr. Abhishek? You have anything to say?
Sir, in our training, we have always been trained that to treat every patient as a HIV positive patient and treat every patient as a tuberculosis patient. So, sir, all those precautions we are already taking, sir. So I think that is a main. That's why we didn't see any of the big outbreak from any of the dental clinics. So, sir, all those precautions we are already taking. So, sir, I don't think so there is any.
Yeah, I think we feel proud here that, of course, I know nearly 700 dental professionals, they have sacrificed their life in this corona Corona war, and they have been warriors. But also I would like to highlight here the dental professionals. Of course, some of us also have been part of this, this huge damage, or huge burden. But we want to say that we've been taking every case, as Abhishek said, every case as a potential case of an infection, and we've been very active. So because of that, I think the number of dental professionals involved, those who have, who had to sacrifice their life, I think has been rather less. That's my feeling. I could be wrong. I have no figures, but I feel that dental professionals, because of their proactiveness, because of their awareness, sensitization, because of their actions, and because of their learning, understanding, helping each other, attending so many webinars, following the protocols, SOPs, guidelines. I think it has shown us a way, and I think the damage has been far less. That's my feeling. Is that right? Sangeeta, you have to say anything in this regard?
No, what you are saying is absolutely right. Initially, there was this fear of practicing dentistry. There's no doubt about it. But with passage of time, as people are getting used to the idea of coronavirus being there in times to come, I don't know. It looks as if it is going to be there for some time. That fear is going away from all of us, and we are all stepping forward and practicing dentistry as we should, of course, with all the protocols in position. That is extremely important to avoid any kind of catastrophe. You did say many dental surgeons have given up their lives, which ought not to happen, actually.
Yes.
Uh,
So, thank
Dr.
you,
Mahesh,
Mr. Tiwari, and thank you all the panel of experts
Dr.
here.
Mahesh,
But yes, sir.
तिवारी जी अभी कुछ टाइम बाकी है
Yeah. No, you go ahead.
क्या कुछ ऑब्जर्वेशन और क्वेश्चंस मैं भी रख सकता हूँ?
Maybe question नहीं, but I would like to sum up, and I would like to.
नहीं, आप sum up करेंगे, लेकिन
so I'm going to take 5-10 minutes for that.
There are few queries and
Okay.
perhaps observations. A
Yes.
wonderful discussion amongst all four of you, and somehow we have come out with some of the very wonderful ideas, and the best possible practices has been adopted by your colleagues in dentistry, and we appreciate it. So sad to know that 700 dental professionals, and this gives us very, very sad feelings, but it's true with the other healthcare givers also. One thing which has been mentioned is the concept of teleconsultation, telemedicine in dentistry, and especially this is true with the medical college scenario who are involved in community dental care. When we get involved in community dental care, definitely there has to be development of more and more technology in connection with the dental problem visualization. Once we visualize it, only then we can give the consultation. So is there any evolving technology in tele-dentistry?
I feel that one thing I have seen that this pandemic, you see, earlier the teleconsult or telemedicine or teledentistry so-called was more, it's predominantly used in a medicine side. Then it was not so much about dentistry. But this, I think, thanks to this corona, that it has given a new lease of life to teleconsult and telemedicine. And it's like something like on the job training, that you devise your own ways. Like earlier, I mean, did we ever imagine that we were doing a webinar on a computer, and we always used to get together? So by hit and trial, by a lot of errors, and we have now mastered the art. Now I've been doing webinars almost 3 to 4 times in a day.
Yes.
Yes.
So, and you know that, Professor Agarwal, you know it. So I think by trial and error, we have learned, how to use the technology, how to explore the technology, exploit it, harness it, for a use. And, we have, simple things, take a picture, send it to the patient, send it to the doctor, and doctor will see it, or use a camera, you instruct him, show me inside the mouth, you try to highlight it. So things like that has happened. So you tell them what to do. At least, you see, now you know that a lot of doctors are still not going to the clinics, especially physicians, and they are meeting their patients only this. And sometimes they also tell them, okay, bring a blood pressure instrument, ask your assistant to put the cuff on your this thing, show me the figure, do it again, is it right? So all those things, it's like a trial and error. So there is no technology as such, but I'm very sure this pandemic has taught us many things, and this is a new learning, new normal. And I think times to come, we are having haptics, a lot of haptics, and a lot of simulations, which is coming a big way in education. So I'm sure somewhere there'll be newer technologies, modern technologies, contemporary technologies, which is going to impact teleconsultation, telemedicine, teledentistry. And not only it is going to benefit dentistry, I think every stream of medicine is going to be impacted by its benefit. And I think, as it is, the mobile has taken away the human contact. And I think Corona has killed us. Now it is sometimes when you become a COVID positive, you don't even meet your wife and your children, and you lose your contact with anyone. So I think because of these pandemics which are looming large at us, I think in times to come, I only hope that the human contact doesn't abandon, it doesn't decrease, it is not affected, because there are a lot of things which a lot of learning, especially in education, comes by human to human contact, by getting together, understanding, looking at each other, which we are actually deprived of because of these online classes and all these webinars. So the human contact is very important. So of course,
the touch has to be there.
Yeah. Thank you, sir. Thank you.
Sir, sorry to intervene.
One more thing, Tiwari ji.
Sir.
I think our young colleague, Dr. Deepti, mentioned about the role of some sort of indigenous thing. But I feel that since during Corona time, lot of activity is being undertaken by Ayush, and they are coming out with some very definitive solutions. And while respecting our old traditional system in the field of dentistry also, if some guidelines which are being proposed by Ayush but accepted by all of you, that is the most important thing, that those things what they are proposing should have the stamping, yes, we agree that there is definite evidence, so that the public will have more confidence. I would like to comment on that.
Sir, may I request you now Vinay Agarwal ji? He is the
मैं अभी करता हूँ, मैंने देख
Sorry, sir.
सर मैं मीटिंग में था आपकी जगह पर, मुझे आपकी याद आ रही थी.
Thank you.
Hi, Vinay. Hi, Vinay.
Hi, how are you?
We will request Vinay to comment, but उससे पहले आयुष या जो भी हमारे हैं, उस पे हमारे कुछ ऐसी कॉमन प्लेटफॉर्म पे कुछ गाइडलाइन बन सकती हैं या बनी है, which is agreed.
Sir, if I may be allowed.
Yes, please.
Okay. I think this morning we had the Saturday seminar which we have at 11 o'clock. There was a big debate on this, and in fact there were a lot of our colleagues who were raising questions that some of our high ups and honored ministers and all that are linking Ayush and homeopathy for a COVID care without any evidence. I mean, they have no issue in integrating it, but it has to be evidence-based, because reproducibility and evidence these are two very important parameters for any therapy. Their objection is, the IMA's objection is that it is okay, you can integrate it, but it is somewhere, if you're trying to integrate it, it is taking away the glory of somewhere glory. So it can be there, it can be a supplement, but we cannot for sure short say, that this is a treatment for COVID. I mean, of course, all these things are for immunity, and the only way to fight any infection is either increase your immunity or target the infection via antibacterials, antiviral, or antibiotics. So these are two ways to do it. So either you elevate your immunity. So all those can be to enhance the immunity, but you cannot say that they are part of the treatment, because they don't have any strong anti-inflammatory. There are no steroids in Ayush and in Ayurveda. So they say that, why I said day 1 and day 5, because the most important period for a COVID infection is the first 5 days. And if there is a serious problem, if there is any, of course, only about 5% of patients have those symptoms, mild or moderate. And if they have, and if they need urgent care, steroids, or all those, ivermectin or remdesivir, and, to avoid the cytokine storm and interleukin 6 and CRP increase, all those things, in that case, you need steroids. You need something which is fast acting, ultra short acting. So there are no things. So you cannot say that they are treatment for a care. They can be there to supplement. They can be there to beef up the immunity, but they can. So there has been a big strong. And when it comes to dentistry, why I'm talking this is dentistry is predominantly procedure based. See, unless you do a procedure, you cannot take care of a patient. As Deepthi said, urgent care, emergent care, and other care. So where that you have to do a procedure. Why 96 patients were treated in April? Because they could not be treated at home. They tried their level best with medication. They had to come to a hospital, and those root tooth has to be opened up for a pulpitis or something. So I don't know what could be the role of
पीछे का वो डाल दियो यार.
I think perhaps there can be a joint discussion.
Screen लगा दे screen.
Maybe after a couple of months, you may come out with some definite.
No, certainly, sir.
Vinay, now
Yes,
we
sir.
can request Dr. Vinay, our ex-president of Indian Medical Association. Vinay, we had a wonderful discussion on dental care in COVID era. We would like to give your expert comment before Professor Mahesh gives the final remarks.
It's an honor for me to be here. I'm so sorry for being late. I was involved in a different discussion, what Mahesh mentioned just now. And I will also raise it. See, through this platform, it should not be misunderstood that Indian Medical Association is not against Ayush. We are not against Ayush at all. We want Ayush should be developed and promoted, and the research should be promoted to any extent, and it can be supplemented or whatsoever it can be done. Or even we far flung this thing, we can say, even if it requires a kind of a integration at some place can be done. But giving such false claims, as our honorable minister has said, were really defaming the entire efforts done by the COVID. It is so unfortunate that the Ayush minister himself has come out of the clutches of COVID, and I'm sure he has witnessed death. What it is, he was on ventilator for a long time in Goa and then was shifted to this place, has come out of it. At this moment, saying these kind of statements, which are, totally a different perspective. See, I agree with what Mahesh has been saying, and it's absolutely correct perspective he has taken. Ayush and other supplements still today can be immune boosters. Absolutely fine. Whatsoever we are giving as an immune booster, immunity booster is fine. But claiming it that it is a treatment is just like claiming Coronel as a treatment of corona, and it is so much in demand in South that it is in black. Now, those are the kind of things which are wrong, and which are totally spoiling the efforts of medical professionals. We must know, and I bow my head to all those about 590 doctors who have died so far, struggling with this corona, and trying to fight it out from all aspects. So I'm sure, and I want to compliment Double Helical and Dr. Arun Agrawal, sir. You have been really great, and we can never have a person like Mahesh Verma and Deepti talking on this issue. And I mean, wonderful talk. I have not seen, but
Thank you,
I
sir.
presume that it has to be good. So
Thank you.
so
Thank you.
that has been good, and Double Helical is doing a good job, at least getting connected on various issues,
Sir, I would just like
medical.
to interrupt here. I would just like to interrupt here. Thank you so
Please,
much for
please.
the appreciation. Sir, I was just thinking at the back of my mind that Patanjali had launched this coronal tablets and he was claiming that corona se mukti and प्रत्येक इंसान कोरोना से फ्री हो जाएगा and he will not be affected blah blah blah. I said, where is the facts? Where is your literature on saying that coronal tablets is curing corona? The people have been bluffed and taking it for a toss. Everybody is buying coronal, and even here at Nagpur, Maharashtra, I can see people flooding at Patanjali and taking this coronal tablets, sir. It is so heart wrenching to see that people are getting bluffed. It
Nikki,
is
I mean, let me
only
just
an
tell you,
immunity booster.
Dipti,
Sir, it is
it
only
is
an
different
immunity
this is
booster,
platform.
sir.
We
It
can
is not
discuss,
a cure.
So
such can be
let us
discussed at
yeah,
different.
let us not raise
yeah.
these controversies any further. Let
We
us end our webinar on a very
No,
positive
it
and a
just
very
come out in my mind, sir, once. Right,
yes.
right.
Yeah, I think this is what
I agree, but it just came out in my mind, sir.
yeah. But
Because
Vinay,
Absolutely,
I
Deepti, you are
am
right.
following the medical field and the
Yeah,
Ayurvedic field and the homeopathy field very closely.
but Vinay, thank
we
you so
want them
much
to
for
be
joining
promoted.
us. Thank you so much for joining us. You know all that the leader has the last word, and you came in the last, and you your last word was so important,
that's
and that is
national
the
leader.
gist of the whole
National
matter,
leader.
I think. So, but yes, I like your statement that you are not against any pathy or any system.
Right.
But the only
Absolutely,
thing is that
There
if
has
absolutely.
to be
unless there
evidence.
is evidence, and we are all living in a modern age,
Right.
unless
There has to.
evidence, we cannot say yes. It can supplement. It can be additive. It can be adjuvant.
It can aid.
But it cannot
Right.
replace.
Yeah, yeah.
It
Yes,
cannot.
sir. Yes, sir.
Yes, thank you.
Right.
So,
I'll
if
just, Mahesh, I'll just add a small anecdote to it that
yes,
3 days back, a pharma distributor from South, has
yes,
asked if I have some contact in Patanjali because
yes.
Coronel is being sold in black there. So that's what the
Black,
only thing
right.
I'm stopping here.
Wonderful.
Yeah, thank you, Vinay. It's
Thank you.
always wonderful to have you, and especially we had a very healthy. And I never actually, to be very
Very.
honest, I never anticipated that this discussion would be so stimulating and it would be so productive and so heartening. And in fact, because we know that there's another dental care seminar which we have been reinventing again and again. But I
Sir,
think.
that is, sir,
Yes,
sir, that is the reason I try to club my dental practice with some home remedies also,
yes,
which I just
Absolutely.
mentioned in my talk session.
yes.
That I do
Yep.
practice dentistry, but the patients which are not very critical, not in emergency state, I do a tele communication with patients and I give them home remedies also. So
So,
I'm not against with the Ayurveda and the home
yeah.
therapies,
So,
but yes, there has to be evidence-based practice.
yeah.
It
Okay,
only can
so
hold the
let me allow,
situation, but
we
it is
just had,
not the cure.
yeah, we just had about 8 minutes, and just if you give me 5 minutes, I would just sum it up and share with you that what we discuss
Right,
here
sir.
and what are the carry home messages, reinforce them. And we opened with Mr. Amrish Tiwari's remark, and he welcomed everybody. Dr. A.K. Agarwal did say that the
Yeah,
dental
please.
care is the most wanted care. And myself, I said, I gave the background, how all this happened, how we evolved, what maids did. And then Dr. Sangeeta Talwar took over and she talked about dental care guidelines and how maids, proved a front runner, in this endeavor. She said maids was uninterrupted care. There was a pre-screening which was intent done outside. In the beginning, there was a task force, and task force formed of different group of individuals for pre-screening, triaging, developmenting development guidelines for the departments, and numerous committees were formed: infection control, biomedical waste, coordination, welfare, infrastructure modification, purchases, centralized procurement, and employee welfare. Because there were a lot of issues. Our own doctors and our paramedical were turning positive. So there were issues about that. So the first step was pre-screening and sample collection, and that is for everyone, is that if patient is negative, goes for triaging, and then it goes to, is sent to the concerned specialty, and there is no accompanying person, hand hygiene, physical distancing, separate holding area for old and new patient. But if patient is positive, then of course a home quarantine as per the protocols. So the first stage in a dental care is a pre-screening at the 3 levels: thermal alert, medical screening for symptoms, cough, fever, breathlessness, and dental needs assessment. And the second was a sample collection. I'm very happy to find, Sangeeta, that MAIDS has been collecting samples for both RT-PCR as well as rapid antigen. Almost 4,000 tests have been done. And the third was a dental triaging, for dental need assessment and sending it to the concerned department. The second thing which is needed for a dental care is the infrastructure changes. That means there are transparent screens, barriers between employees and patients, space seating, pedestal fans for good ventilation, HEPA filters for air purification, clinic area segregation from academic area, because even in a dental clinics, there are areas where doctor sits, offices, labs that have to be separated from the treating area. So clinical changes were manpower need, additional assistance, sanitation and cleaning staff. They were trained, they were sensitized. Coming to the prophylactics, PPE mandatory for doctor and assistant, pre-prep mouth rinse, very important, 0.2% povidone iodine and 1.5% hydrogen peroxide, and extra oral scrubbing. I think very good point, Sangeeta, which is not normally talked about. I think very good. Reduce aerosol, fan behind the operator, and HEPA filter, multi-chair clinics. Just like spacing in seating, we can also do spacing in treating in a multi-chair clinics. Electric motor, better than aorta, rubber dam, high wax suction. When it comes to infection control, so you talked about NABH guidelines. That means 1% sodium hypochlorite into the water pipelines, 0.01% sodium hypochlorite in the spray, which comes in a handpiece, mopping with disinfectant, 20 minutes gap between 2 patients. So that's why it takes much longer to treat these patients. Fumigation at the end of the day. So after all the service is over, all the clinics are fumigated and readied for the next day. So patient load has been increased over the months. As I said, that you had only 96 patients in April, and today you have almost 5,000. And training and sensitization of the staff also required in the clinics, because all the supporting staff have to be constantly motivated, energized. They have to be encouraged, they have to be trained, they have to be sensitized all the time. Otherwise, they will lose that gusto, that feeling, and it will dampen their spirits, and they have to be constantly, that's the key, that you have to always keep them on their toes. And so online activities, academic and CDE activities were on, and I liked your ABCDE. A was air ventilation, B was barriers, C was cleaning, D was disinfection, and E was education. I think that said it all. And let us adapt to difficult times. That was your parting statement. Wonderful presentation, Sangeeta. Lot of information, learning for us. Then we had Abhishek Kukreja. He basically talked about aerosol and how it can be, what is aerosol? He said aerosol is very minute, less than 550 micron. It's a mixture of water and other particulate matters. It stays in air and it can enter the respiratory tract. So 20 minutes gap between the patient is very important. That's why, because you want this aerosol to settle down in the clinics so that you don't inhale it. Patient is needed Disinfection of water lines important. Sangeeta, you also talked about it. And he said, what is the source of aerosol? Dental handpiece, ultrasonic scalers, air polishers, air abrasion units, and three-way syringes. These are the common source of aerosols. And aerosol is not only infective aerosol is not only because of the dental equipment, it could also be patient, because patient's mouth could be harboring the receptors in the mouth, ACE2 receptor, which clings, which has affinity to coronavirus, can have a lot of virus, and that can also be part of the aerosol. Reducing airborne infection is by prophylactics, PPE, masks, mouth rings, high vac, and HEPA filters. And he also said clinics should be well ventilated, and 4 essentials. He said that means universal precaution, pre-procedural rinse, rubber dam, and high vac. Then we had a Dr. Deepti Sharma. She had a background of a general practice, but forensic, implants, and civil defense. And she said COVID has led us to redefine dentistry. It has also reunited profession. I like that statement. And that's why I was talking that because of that, we have had a less number of casualties in dentistry, because it has united profession and we have learned from each other, and it has given a lot of learning. She emphasized good oral hygiene can also reduce transmission of COVID. And she said CDC Atlanta has recommended that good home care is very important for self and the family. And she said a very good point is that you replace the toothbrush. If somebody has had a COVID, and replace the toothbrush or the head of the toothbrush if it is rotary, because after you would not like to be using the same toothbrush after you had a COVID. So disinfection of the entire equipment surfaces in the clinic, and disposable supplies, protective equipment, and care division. She said 3 kinds of care: non-urgent care, only need a teleconsult; urgent care, consult on phone, schedule, treat, and if it is emergency, you treat them right away. What is urgent care? What is urgent care? When do you want to do urgent care? When there is excessive pain, bleeding, bacterial infection, trauma, or if there is any airway which is being impacted for some infection. So that's the urgent care. So what are the home remedies? She said through teledentistry: cold compression, garlic crush, vanilla extract, alcohol. A little controversial. She said alcohol in local swab, and wheat grass. She said wheat grass mouthwash. And she said brush, rinse, massage, tongue clean, and visit your dentist regularly. I think some of these things, as I said, is not only for professionals, for general public, and that was good. And she gave us 6 steps for sterilization: wash hands, chemical sterilize, ultrasonic clean, dry, separate and package the instruments, and autoclave. And that's how we do. Whenever we do autoclaving, all these we have to follow these 6 steps. Why infection control is important in dentistry? She said because dental operatory is very infection prone through direct and indirect and environmental systems. So due to aerosol. Then we had a little input from Dr. Arun Agarwal. He said dentists can order COVID test. Yes, prescribed by dentist Dr. Sangeeta Talwar. Even when suspected, we should be advising, we should be asking for a COVID test. Dr. Abhishek, should the doctors allow that? And Dr. Deepti should be allowed the test, and we should have our own lab, he said. Dr. Swati Maliwal had a question whether COVID positive patient, if there was a contact with a COVID positive patient, can you continue treating patient? No, it cannot be done. And the duration of the quarantine, of course, keep changing from time to time. Dr. Sangeeta Talwar, less than 3 feet or more than 50 minutes. That's the gold standard. If you have had a contact with somebody less than 3 feet, and which is slightly overdoing, because we say 6 feet, but if somebody comes a little closer, then, and if you had spent more than 50 minutes, if somebody who's a COVID positive, it's very mandatory that you go for a test. Then coronavirus is an aerosol virus, protection, the dust, somebody had asked that question. And Ruchika Tuteja said, are dental x-rays safe? Why not? It is very important, absolutely safe, but IOP x-rays to be avoided. Dr. A.K. Agarwal, wonderful idea generated in today's discussion. Telemedicine in dentistry, especially involved in community dental care with technology. And I clarified that there are no new technologies, but we have adapted, we have harnessed, we have exploited the same technology for telemedicine. Dr. A.K. Agarwal, Ayush has definitive solution. Whether anything can be done for dentistry. Yes, surely something can be done. Some of the guidelines to be made jointly with Ayush, and dental care is a procedural base, so it will be less effective. It can be effective in other things. Dr. Vinay Agarwal, he was very honored to be part of our joining today, but he said it should not be misunderstood that IMA is against Ayush. He said integration can be done, but no false claims. And Ayush can be immune boosters, but there can be no claim for treatment. And Bo, he also bowed his head, and he appreciated that 590 doctors have been lost because of the war against this corona. So, friends, it's a wonderful opportunity to not only meet up, interact, and discuss and redefine. In education, although we know everything, but unless we sensitize, we talk about it again and again, we relearn, and it comes to the surface so that we apply it every day, day and out. Thank you very much for giving me opportunity to be moderating this webinar. Thank you very much.
Thanks to all. I'm very obliged to you are here and discuss what we needed. Thank you. Thank you, Dr. A.K. Agarwal Sahab, Dr. Vinay Agarwal, Dr. Dipti, Dr. Mahesh Brown, Dr. Sangeeta Talwarji. We will meet again.
Thank you, sir.
Thank you.
Thank you. Thank you very much.
Thank you.
Thank you.
Thank you,
Okay.
Mahesh.
Thank you, sir.
Thank you, Sangeeta, Deepti, Vinay, and everybody.
Thank you, sir.
Bye for now.
Thank you. Bye.
Thank you, Sangeeta. I learned a lot from you. And thank you, Mahesh Verma, sir. Wonderful person indeed. And thank you so much to all the dignitaries, to all the staff. And thank you, Amrish ji, for having me here. Thank you very much again.
Thanks. Namaskar.
संगीता, ये पीछे बैकग्राउंड कौन सी है?